Thank you so much, Leanne. Yes, I do indeed. Here's a rather disturbing projection, and it reads as follows. South Africa will miss next year's Millennium Development Goals on reducing child and maternal deaths. Now, that's according to the 2015 Countdown report. It was released recently. However, there has been progress, Leanne, and I think I need to stress that part. Figures show that the country has managed to reduce under 5 child mortality from 61 deaths per 1,000 births in 1990 to 45. But questions are now being asked whether or not we will meet the target of 20 come the end of next year. To tell us more about an initiative that plans to do just that, not only reduce mother, child, infant mortality, but also improve the healthcare system in South Africa. We've got to Dr. Motsoaledi to talk to us about MomConnect. It's a cell phone initiative that gives you and I, Leanne, the consumer or the patient, power in the palm of our hands. Mr. Minister, a very good morning to you. Thank you for your time.
Good morning, Ayanda, and good morning to the listeners out there.
You've described MomConnect as a game changer, that it will help the citizens and the ordinary South Africans who are looking for quality service in hospitals and clinics. It will help them get just that. Describe it to us quickly.
Well, indeed, in as far as pregnant women are concerned, today we are launching this project to connect 1.2 million women who fall pregnant every year in our country. And two things are going to happen with this connection. The first thing is that we'll be sending the messages appropriate to their stage of pregnancy, telling them what to do at every stage, telling them what to avoid, what is expected of them. Even after the birth of the baby, we'll still send the messages 1 year after the birth of the baby, focusing on the baby. What must they do to the baby in terms of immunization, breastfeeding, and many other problems? That is the first thing. The second thing is that the mothers themselves will be empowered to send us messages at no cost to themselves. They can even say, please call me and complain or compliment and say, I'm at this clinic, this is not happening, or this is what I'm experiencing, or I was at this clinic, I was extremely happy. I think things are going very well in that clinic. So at any one time, we'll be knowing what is happening to any pregnant woman in our country who is getting care from our healthcare facilities. We are registering even the 200,000 women who are going for private health care, because going for private health care doesn't mean that you know much about your own pregnancy. We'll even give them messages about that.
There are hopes and aspirations that MomConnect will help to reduce infant and child mortality rates and maternal mortality rates by giving moms and moms-to-be information as to what to do in various stages of their pregnancy. I want to know from you, though, when it comes to the Millennium Development Goals, specifically number 4 and 5 that relate to this topic, how far are we in reaching them in South Africa? Are we going to meet the target of next year?
Well, to be honest, it's going to be a mountain to climb, and we're still left with about 500 days, but it's an uphill battle, not only in South Africa, but in the whole sub-Saharan Africa. Let's talk about maternal mortality. Our mortality committee, which works on a triennial basis, has shown that there are many things that that kill women in pregnancy and childbirth in the country, but three have become very, very obvious and prominent. And coincidentally, they all start with an age. The first age is HIV. 50% of our maternal mortality is attributable to HIV and AIDS. And so if we don't have very serious and strong programs on HIV and AIDS, we're going to lose the battle. But you and I know our battle against HIV/AIDS started very late, around about 2009. If we started earlier, when Millennium Development Goals were declared in 2000, we'll be very far. But in the past 14 years, we started only 5 years ago. So that's our weakness. The other 2 ages, which we believe will help a lot if we intervene, is obstetric hemorrhage, just bleeding in pregnancy and childbirth. And the last age is hypertension in pregnancy, because pregnancy can induce hypertension. These 3 are the main causes, and if we look at them very carefully, as we are going to do now, within these 500 days, we can still make a change. Then let's come to the perinatal period, the period around birth and the first 28 days of life. 3 causes were also identified. It's infection, asphyxia, and prematurity. Prematurity, most infants are born too premature to survive. And who is giving birth to premature babies? It's young girls who themselves are still too young to fall pregnant, which means we need to strengthen family planning. And you know we have done so. We have launched a big family planning program in February this year. Then comes to the under fives. What is killing under 5 children before their 5th birthday in our country? Again, 5 causes were identified. The first one, still the age. HIV and AIDS, it kills 50% of all the children who pass on before they reach their 5th birthday. The second one was diarrhea, then pneumonia, then severe malnutrition, and TB is starting to come in. So there are 5 causes, and we're all looking at them. For diarrhea and pneumonia, you know that in 2008, we've introduced new vaccines, pneumococcal vaccine and rotavirus, to deal with those. For severe malnutrition, I was jokingly saying I'm happy about the Gazette passed by the Department of Trade and Industry, which is following up on fathers who default on maintenance. It's going to benefit us if men are forced not, because you are aware that studies show that there are 9 million absent men who have made children and ran away.
And so they'll now support their children. There'll be
come
food.
Into our clinics with malnutrition.
No more malnutrition.
Issue.
I like the fact that all of those that you've mentioned are preventable, and knowledge is often key, because if you know what the problem is and how to find help at a public healthcare facility, that's a first step. So MomConnect, I think, will go a long way in making sure that moms and moms-to-be are well informed. Mr. Minister, my thanks again to you for your time. We've unfortunately run out of time, but thank you so much for joining us this morning.
Thank you. Thank you.
The minister was joking, saying that parents and moms can also kind of rat on a nurse or doctor that's not treating them very well as well. So you have the power in the palm of your hands through MomConnect. You can alert officials when an authority figure at a private clinic or even a public clinic is not performing at the best of their ability. So we'll leave it there.